Now what we're going to focus on is a radial gutter orthosis. I find these orthotics particularly difficult at times, just because of the amount of creases and the number of joints they have to pass. So we're going to try to take the worry out of the fabrication of this common orthosis. We do this quite frequently in our hand clinic. So what I'm going to do again is go back to tracing out the hand. I find this gives the clinician an easy way to remember where bony landmarks are. So once I complete tracing this out, what I'm going to do is mark where my PIP joints are at, on the index and the long finger. This splint will be a radial gutter, so most of the time it'll entail a fracture of either the proximal phalanx, base, or metacarpal fracture. We're going to incorporate the wrist into this one here. From that position, in my web space and at the CMC joint, I'll make 2 marks. This is where my hole is going to be in order to slide the thumb through. From this here, I'll come at about a 45-degree angle, up over the interphalangeal joint of the thumb, the IP joint of the thumb, and then down. Then I'll drop that straight down to the forearm. I'll make a little line here because I want it 2/3 the length of the forearm. I'll just extend that on my piece of material right here. Go ahead and lift that hand off for me, please. There's my dotted line, my PIP joints for my index and long finger. So my IPs will be free, and I begin to open this up for my thumb. I'll then cut out the pattern. Fold that over, create the hole for my thumb. Now I'll go ahead and place the hand on the table, wrist in whatever position you want, MCP joints in about 50 to 60 degrees flexion, and many times it's whatever you can get them in post-operatively. And one thing to be careful of, to make sure to know, is that whether they have K-wires, pins that are exposed, we may have to put dressings around that to pad that, or even create windows within the orthotic in order to allow those so that we can distribute that pressure. This will go over the thumb. And just to give me an idea where the pattern will go, what hand the position will be in. I'm going to trace it on my material and be ready to cut that out. Now that we have our splint pattern cut out, we want to be able to get that thumb hole out. So we'll do a little softening of the material. Wipe that off. I may use my scissors to poke through that and then trim that out. We're going to roll that out. And whenever we put a roll or fold in our material, it's going to create some more strength. And I'll place that material in the splint pan and get my patient ready. While that's preparing, I'll set up my patient to ensure that I'm in a good position. If they're in a good position, for all intents and purposes of this demonstration here today, I'm going to place them on the small finger side. I can either use a towel or a built-up blue elevator to move along with this as well. I'm using a 1/16 inch micro-perforated aquaplast. I find that material is very strong and conforms very well. And our physicians, orthopedic surgeons, and our other hand surgeons find that they like this. It's lighter for our patients, very comfortable. We have much higher compliance rate with this and a very nice intimate fit. So the material should be ready. Bring that out. Pat that material off. I will pinch and lay that material. Bring your arm up here. Thank you. And get that to material to conform. Based on the surgical procedure, we'll determine what position you want either the MCPs in or whether you want the interphalangeal joints free. I'll let gravity do its work. And what I do with these is sometimes with these orthoses, they have a tendency to shift either distally or more proximally. Once your patient's in the right position, I'll go ahead and do my fine trimming afterwards. With my PIP joints, it's just a little distal. This one looks pretty good over here. I'll mark that afterwards and trim that off. And I'll mark where I want to trim off any extra material. Once I've trimmed off the residual material, I'll place that orthosis back in place and refit. Now at this point here, what I want to do is give them more motion around the thumb. We have a couple different options right here. You can either pour more water over top of this to go around and fold that back, or you can go around, which will make that thicker, or you can go around and trim that around here. Sometimes what I do is just dip that in there, and we'll roll that back. Whenever you roll that edge, it gives a nice smooth edge. And you want to do this just a little bit at a time to ensure you don't affect the rest of the orthosis. I'll place that back. Look again, and now I'll begin to strap my material on. So now we have our finished orthosis at this point. What we have is I put one Velcro sticky back strap here, one here, along the metacarpals and along the proximal phalanx. So I'll go ahead and apply this back on your patient again, ensure a good fit. We'll apply the orthosis, or the strapping, as it conforms to the forearm. I do 1.5 inch strap here, around the metacarpals, strap it here, and then I'll have this little cut here for the web space. I'll slide that between the fingers, here and here. And now we have our final radial gutter orthosis. To make a hand-based orthosis, all we have to do is trim this off down here, or even come through here and place one strap around here. Here we have a radial gutter forearm-based orthosis, and it's going to be, indications will be for metacarpal fractures. With some proximal phalanx fractures, all you have to do now is extend this up to the tips of the fingers to encapsulate that, to keep the PIPs and DIPs joints from being mobilized as well. Again, what you'll do is you'll place usually between 4 to 5 straps based on whether it be the PIP joints free or the PIP and DIP joints involved in that there. And there's your final orthosis. Another way you can do sometimes to edge this is you can use an edging material to go all the way around to ensure that there's no pressure areas from the edges of the material, because sometimes the microperforated material will not edge very well based on this cuts through the perforation. So you can take a look at a dorsal view, radial view, and a palmar view. So now I'll talk briefly about the indications for this radial-based metacarpal fracture brace. And really, you can use out of various materials. This is made out of 16th microperforated aquaplast. It's a very stable material. It conforms very well. You can use 1/8" Tailor splint, easy form. So again, radial-based is going to be more for metacarpal fractures or proximal brace fractures of the index and long finger, D1, D2, or for the ulnar gutter, it's going to be for fractures of the ring and small finger. So we're going to encapsulate the digit on the adjacent side of that in order to give more support for that healing structure. One thing you also want to make sure to watch out for again is for K-wires, any external fixators or pins that you might have that you may need to pad or support or actually splint around those as well. There are several variations for this orthosis as well, with a radial gutter design, again based on the type of surgery being performed or any post-operative or surgical or even conservative management fracture programs. Based on the needs or the healing for that particular fracture, you're going to want to flex those MCPs to whatever degree you possibly can, or that is indicated. In order to make it, you can either have the PIP joints involved, where you move more material distally out to the fingertips, or you can cut it off at the interphalangeal joint, PIP joint level to allow the PIPs and DIPs to flex freely. You can also make it a hand-based, where you'll just cut down at the wrist level for this orthosis, and then you'll have the wrist free and it'll just be a hand-based as well.